Good morning, church, and good morning, family. I felt the calling that has been nudging me to share a bit of my spiritual talent as a physician to talk to you regarding what we're facing now as a pandemic of the coronavirus. To me, this is a very important subject and very heady. So I want to take time to read information off of a letter that I put out, and I will make sure that the information on this letter will be available to you through our church website and with links to any information that may be on it. But I do kind of apologize for the importance of me reading from my notes. As a personal background, my name is Dr. Todd Bush. I graduated medical school in 1989 and have spent the past 31 years practicing internal medicine. My wife and I are members of this church since 1992. I consider this congregation and this town as my family. I have raised 2 daughters in this community and plan to grow old here. For these reasons, I truly am nudged to share some of my COVID knowledge with the remainder of my family. I want to give people tools necessary to help them manage both their physical and mental health during this time frame. I know many of you take notes during the pastor's lectures and sermons. This might be a good time for you to grab paper and pen. I will try to provide links to some of this information through this channel, but others may simply want to write it down. What is COVID-19? It is a novel coronavirus. Novel. Novel is a term that the medical community is using for a never-before-seen type of infection. This particular one was first detected in Wuhan province of China. Corona. Corona is a family of viruses that cause infections that range from everything from the common cold to severe life-threatening respiratory illnesses. And then virus. Virus is a term that we use for an immense group of organisms that rely on other living things for their own survival. Since this is a novel virus to humans, this means that everyone, young and old, wealthy and poor, healthy and ill, Christian and non-Christians, are absolutely at risk of this infection. It is because of this universal risk that we are placing so many restrictions during this pandemic. I encourage us to embrace these restrictions and follow them religiously. We have a paramount responsibility to care for our neighbors as we would have our neighbors care for us. How is this actually spread? It is important to understand some facts as to how this virus is truly spread. This strain is a member of a coronavirus family. This acts just like other members of its family. It is aerosolized, meaning it is in respiratory moisture droplets that are spread from other people. It is not spread from outside air, packaging air, clothing that has not been recently touched by others, Chinese imported products, mail, care packages, letters, and most certainly not because of our individual ethnic backgrounds. Who actually is getting infected by this virus? Our older and often less physically active populations are the most vulnerable, as is with other coronaviruses. While we certainly cannot make ourselves younger, we can certainly become more active. My recommendation is to visit YouTube site or even an internet link that will be found later in this channel, but for now it is Go for Life Exercises for Seniors. How many people may become infected? There are large numbers of mathematical models trying our best to predict the future of this infection, but I'm fearful we cannot. We can only use some concrete data that we currently have. This is, first, the Diamond Princess cruise. This was a cruise ship that was traveling in the South China Sea. From January 21st to January 25th, passengers began falling ill. This was with an unexplained respiratory illness. By the 4th of February, it was quickly noted that they must isolate these individuals and begin testing. By the 20th of February, 3,700 individuals have been tested. Of these 3,700 individuals tested, 619 have been confirmed to be positive. Slightly less than half have developed symptoms, but unfortunately, 7 have succumbed to the illness. Another piece of data is Chinese population data. According to the World Health Organization, there are slightly greater than 81,000 confirmed cases in China. This is out of a population in China of 1.36 billion. We can expect that with appropriate social distancing, personal hygiene and care, we can expect rates anywhere between these two pieces of data. It is my recommendation, therefore, to do some of the following. Please, keep it simple. Please, do not succumb to false ideologies. Simply follow the following. Frequently, wash your hands with soap and water for at least 20 seconds. If available, use alcohol-based cleaners. Please do not feel that you must have access to these cleaners, as hand washing is felt to be equal, if not superior, by others. Second, please clean any surfaces that could be exposed to human touch. Sneeze, sniffle, or even a cough, clean that surface. Commonly overlooked surfaces may include doorknobs, light switches, cell phones, your toilet flusher, game controllers, TV remotes, and even appliance handles. Third, since this is an aerosolized virus, human droplets spread illness. And yes, social distancing is truly effective. Droplet transmissions are very much minimized when we keep greater than 6 feet separation. Please, do not rely on being simply fed information from sensationalized broadcast news sources. Appropriate and very easy to understand information can be found on YouTube links or internet sites at the following: World Health Organization.international, the CDC.gov, the Pennsylvania Department of Health. And finally, the exercise link will be Go for Life, Exercise for Seniors. On a very personal note, I've been trying to teach my friends, my family, and my patients that we need to learn to treat the palms of our hands as our own private parts. If we can teach others not to reach out with their palms, keep our palms clean, and do not use them to touch our faces, we can truly lessen the risk of this transmission and very much take care of others around us. So thank you very much for this opportunity to share some of my spiritual gifts, what God has blessed me with, and I really hope that this understanding provides you some comfort in the coming weeks.